We have lots of processes and lots of automation in place that are allowing us to, check ourselves and be sure that we're doing our due diligence for our clients.
You're listening to Beyond the Claim, the show for forward-thinking risk and claims professionals curious about the latest industry trends, winning strategies, and stories from influential leaders. Let's dive in.
Hello, everyone. Welcome to this episode of Beyond the Claim. I'm your host, Mark Cunningham, Chief Sales and Marketing Officer with Broadspire. Today I have with me Suzanne Jordan, Broadspire's Manager of Ship Reporting. Suzanne, welcome. Thanks for joining us.
Thank you so much. Thanks for having me.
How are you doing today?
I'm doing great.
Excellent. Well, nice to see you. Nice to hear from you. So Suzanne, I said Broadspire's Manager of Ship Reporting, and I'm sure for a lot of our listeners who are maybe not in this space or are new to this space, they have no idea what I'm talking about. So
Right.
I would like to spend some time for sure defining what that means. But before we do that, I'd love to hear more about you. So maybe just can you give us a little bit of your background, maybe pre-Broadspire, during your time at Broadspire. Tell us a little about Suzanne and your career journey.
Okay, great. So I've got about 20 years IT management background. So I've had teams that support servers and desktops and things. So when Broadspire contacted me and said, "Hey, we have this position that we think you'd be a possible fit for," and when they mentioned Medicare, my initial response was, "Well, I don't have Medicare experience." And they said, "No, that's not what we're interested in. We're interested in the IT management background." So I was hired on in 2009. So I've been doing this since the inception of Section 111 reporting, which I'll explain a little bit. And I've been with Broadspire now about 15 years, but I came on board and I built a team, and we've just got an amazing team.
Fantastic. Yeah, I know there's quite a bit that is done behind the scenes that many aren't aware of that is critical. So Suzanne, we have SHIP and Section 111. Are they synonymous? What does SHIP stand for? Can you give us a little bit more insights into so we have a clear and solid foundation to work from?
Absolutely. So let's talk first briefly about why Medicare, the Center for Medicaid and Medicare Services, is doing this. So Medicare has been paying out billions of dollars that do not they're not responsible for it. So let's say somebody goes into a emergency room and they've got a broken leg from a car accident. Well, their car insurance typically would pay that. But if they just go in and the hospital bills Medicare, they've been paying out all this additional money. So they put their foot down. They came up with a really solid and very lengthy and complex rules with both medical providers and with insurers and self-insured employers. So now that they've put that together and defined it, they initially said they were going to fine us $1,000 a day for any claim that went unreported. And that was actually shocking in the industry. I think people really kind of woke people up like, wow, they're not kidding. And the amount of data that they would like to be reported, there could be more than 106 data fields for any one claim. So it's an enormous amount of data. So we've all in the industry trying to work out the kinks in the process with Medicare. Now things have become much more defined, and Medicare really did take heart and listen to the industry when we gave our feedback and said, hey, you need to look closer at the penalties and how you're going to do this. I mean, companies were afraid they were going to go bankrupt, things of that nature. So there was a lot of fear out there initially. So Medicare really took everyone into account. They just rolled out their final language in October 11th of 2023. And let me tell you, the clock's going to start ticking for late reporting of TPOC, which stands for total payment obligations to claimant, and ORM, which stands for ongoing responsibility for medical. So those are the two components that they're going to look at. And, quite honestly, Mark, we were relieved, very relieved. It could have been so much worse. So they really did listen to the industry's input. We're in a good position. Broadspire is in a great position. We've been preparing for this for the last 15 years. So we have lots of processes and lots of automation in place that are allowing us to, check ourselves and be sure that we're doing our due diligence for our clients and our carriers alike.
So just to get into the weeds a little bit further, is the expectation that service providers are identifying Medicare eligible claims and reporting those, or are we reporting everything and the government is determining what's pertinent and what's not? Who makes the determination of what data to share?
The great question. So the first piece is you have to identify, is the individual that you are going to settle a claim for example, a Medicare beneficiary? Are they on Medicare benefits? And there's a misconception out there. I think a lot of people assume, oh, well, that's only people that are over 65. The reality is more than 50% of people who are Medicare beneficiaries are under the age of 65. And that holds true in our environment as well. So it's not an age driven thing. But once we know they are a Medicare beneficiary, we know that we have a federal obligation to look out for Medicare's best interest, not only with the settlements that we're doing, okay, because that's called the MSP, Medicare Secondary Payer Compliance, but also this Section 111 reporting. So just because you protected Medicare's interests in a settlement and in a case, if you fail to report it, that's a totally separate entity. It's a totally separate beast that you must do. So they require you to report it and protect their interests. And they've really got some tight parameters around that. But I do feel that because this has taken so long to get to where we are, that it's much more defined now. It's pretty clear, and it sounds very complex, but it's clearer to me. The penalties will be issued in tiers. So, a couple of things for people to look out for. One is Medicare requires an RRE, which stands for Responsible Reporting Entity, to first register to report, and second, they have to recertify their information. But let me just tell you that, that sounds like overwhelming, I think, sometimes to clients. How do we register? It's really a simple process. It's about a 10-minute process. You just need to have your company's TIN, your tax identifier information, as well as somebody in your company who's the authorized representative who has legal binding authority. So someone who can sign for this. So as long as you have that information, it's a 10-minute registration process. And once a year, Medicare will contact the RREs, the responsible reporting entities, and they'll say, hey, is this information still accurate? I mean, maybe you had, a change in your company and you need to assign a different authorized representative. So here's, some of the things that I'm concerned about coming up, especially as October 2024 approaches. We are starting to see at Broadspire a lot of recertification notices going out to clients and carriers and self-insured employers and you name it. And there are many that have not recertified their information in over a year. And in the federal guidelines, it says you must recertify within 1 year. Well, now we're starting to see where they're disabling some of these IDs. So when the ID is disabled, that prevents a company like Broadspire from reporting claims. So that's a real important one that people should be aware of. That's one of the key pieces. So, make sure you're registered and make sure you recertify annually to keep your reporting, going, because, Medicare requires that the company, the RRE, provide that information and not, a TPA, for instance. So that would be one piece of.
No, that's great. That actually a couple of thoughts on that. First one, because that stat was significant. The 50% of Medicare eligible individuals are below essentially the retirement age, if I'm following you correctly. Just out of curiosity, I'm sure there are folks that are interested. what types of scenarios are we talking about? Just permanently disabled, or what's leading them to be in your review of the data Medicare eligible at that rate? Because that's significant.
Right, right. So anyone who is on Social Security disability for more than 2 years becomes certified in their state, and they become, officially disabled. And they have to be recertified by the state that they're in once a year, which usually happens by doctor signing forms and things. And so anyone who is on SSDI is what they call it, Social Security disability, um, can become Medicare eligible if they are on SSDI benefits for more than 2 years. So that's where that
You know,
50% comes in.
and what's very interesting is, we our largest presence in the market is definitely our workers' compensation business, our liability business, but we also manage disability claims, so the non-occupational claims as well, where you're essentially saying it doesn't really matter how you became disabled. If you're disabled for longer than 2 years, Medicare eligibility kicks in. This SHIP component is necessary. The reporting is necessary, and we're providing that service for our clients. What are you seeing, or what do you recommend to those employers that are out there that maybe aren't using a service provider, that are maybe self-administering? Is there an opportunity for them to work directly with you as a standalone offering, or just in general, what do you see as an opportunity within that self-administration space?
I would recommend that anyone who's self-administering claims, again, one of the perceptions that's out there is if you protect Medicare's best interest through the settlement, that you're covered. But if you fail to report, that's where you're going to have those huge penalties. And let me mention real quickly, SCHIP stands for State Children's Health Insurance Program. Basically, why they refer to this as SCHIP, when the government begins to issue penalties, it's going to fund Medicaid. So that's where the SCHIP word comes in and comes into play. But if they are administering, I really think they need to be sure if, it depends on whether they're self-insured or insured. But if they're insured, they need to be sure that their carrier is okay with them handling their claims. Carriers are very sensitive to making sure reporting is happening because they understand that there's a huge risk. I would recommend either working with a third-party administrator on administering those claims, or if you are licensed and you're okay administering, then I would recommend that you work with some type of reporting agent. There's several of them out there, and there's now a lot of new ones coming up that help execute the handshake of all of the electronically reported data to Medicare. So I would say the three important points: register to report, recertify, and make sure that you are working with someone to help you make sure that reporting goes in. And then you also need to look at your disposition codes. A disposition code is what comes back from Medicare. And there are times where there are issues, and they'll come back and say, hey, you didn't report this settlement on time, things like that. So that's going to become very key in the industry, especially as we approach October. Now, right now, we're kind of in a window. We've got this window of time, and, they aren't going to retroactively go back. So let's say we have a claim that hasn't been reported because we were unable to obtain a Social Security number. So we did not know the person was Medicare eligible. Well, Medicare may become, they may find out about that just through the settlement process, and they may go and look and say, well, was the claim reported? So Medicare has provided what's known in the industry as a safe harbor form. And we've got that actually integrated into our system where we can, track those forms. But they're requiring that you make one electronic attempt and two written attempts to collect Social Security number to identify whether the individual is a Medicare beneficiary. So in the instance, and this is how big of a deal it is, Mark, in the instance, so let's say you haven't been able to report a claim because they refused to provide the social, but you never sent out that safe harbor form that Medicare provides, like kind of a safety net for us. As long as you can show Medicare that, yes, we made 3 attempts before we made this settlement, then you're covered. But let's go to the bad scenario. You have a claim that you were unable to report because you did not get a Social Security number, and it's reported 3 years late. You could literally receive a penalty, and I know this sounds extreme, $521,000. and a few little change after that for one single claim. So it's big business. They're serious about it. You need to have that safe harbor process in place if you're handling reporting on your own.
Actually, so my next question was going to be around the penalty. You had mentioned a $1,000 related claim. I think it was 1,000 per claim, possibly per day. But I may have misstated that. But ultimately, that 500,000 you just mentioned, is that based on the cap? Is that what per
Yes,
claim? Is that
that
right?
is the
Okay.
cap. So if you report a claim greater than 3 years, so let's say it was reported 4 years late, and you were unable to provide any documentation that showed that you were doing your due diligence to collect that Social Security number to find out if that person was Medicare eligible. If you did
Yep.
your due diligence, you're covered. If you didn't, you could be in trouble and you could literally get a capped penalty at, that's the extreme case, 520, 22 or 21,000. But
Yeah.
they have a tiered approach. So anything reported more than a year late will incur a daily penalty of 357, I believe. They've just changed it in 2024. Anything reported between 2 and 3 years late tiers up to $714. More than 3 years late, it's now $1,428 a day. So,
Wow.
it's serious business.
Have you heard of any significant penalties at that level being allocated to any groups or individual employers at all?
Well, here's the thing. The clock starts ticking October 11th of 2024. So now's the time. Time is of the essence to get all of those claims reported so that you don't have to face that because right now they're giving you forgiveness. So we have a little bit of a forgiveness window.
Oh,
So you need to go
okay.
back and
Okay.
check your current records and make sure you get those reported. They will not even if you reported it 3 years late, which we've seen that in the industry and it's happened to people before. Um, Even if you report late today and that claim should have been reported 3 years ago, they will not retroactively go back and issue penalties for those. But October 11th, 2024, the clock will start to tick for late reporting of settlements and late reporting of ongoing responsibility for medical.
So in the past, because you had mentioned the penalties, I think was a part. The penalty was a part of the initial law or legislation or section code, but it wasn't implemented. Essentially, what I'm hearing through the negotiations throughout the past 15 years, you've been able to get to this point now where they've said, okay, here's the final wording, and you're saying there's an opportunity to go back and essentially make the corrections. But as of that October date going forward, if you're in the penalty, you will be penalized. Got it. That's interesting. Okay. So is there? I mean, outside of Broadspire, I would imagine from an industry perspective that this is a very active period of time where folks are really ensuring that their house is clean and and that there's no points of risk, right? What does that look like? And I guess as we close out, what do you see coming about post October,
Post
if
October,
anything?
I think everybody needs to know that that's, day one, day two. So if you had a claim that was 300, or I'm sorry, 3 years reported late, and October 12th, the first day is $1,428. The second day is $1,428. So you really need to be sure you have your processes covered, that you're using that safe harbor form, because that's critical, and that you've got, good, diligent processes in place to make sure that you've got that information covered and try to get that information early on in the claim. And, it's a challenge for liability claims and I understand and I get it. And that's why, Medicare gave us an out and said, okay, we get it. You can't force somebody to provide this. So here's the safe harbor form. So as they say in the claims industry, if it's not in the file, the claim file, it never happened. So you need to have,
Didn't happen.
clear documentation. So
Definitely. That could not be more true. Anything beyond October, let's say, 2 years from now, 3 years, are there any rumblings or any indicators that there will be any, massive adjustments or pivots, or do you think that they'll let this sit for a period and mature and then, maybe make some changes down the road?
Well, I don't know if they'll make changes, but I think that they were pretty generous in how they laid out how they were going to look at penalties. So, penalties, the first thing I will say is Medicare, actual Medicare employees are going to be the only ones reviewing claims that potentially could pose a penalty because they felt it was very important. They said, they're not trying to issue penalties, but they will if, you're not in compliance. So, but what they did is every quarter, they're going to pull 250 claims from all RREs, or all responsible reporting entities, across, the platform of non-group health plan as well as group health plan. So, the percentage and the chance is, kind of low, but, they're going to find that one. You don't want to be that one with a huge penalty, but that's how they're going to look at it. I don't know what to foresee in the future, but they have laid it out pretty clearly and they have documented it really well. So I think the industry is pretty clear on what Medicare is expecting. And I think that piece is a good thing. I think they listened to us, and I think they did a great job putting together that final rule.
I mean, it is good to hear that the penalties will be going to a good cause in Medicaid, but I don't think that anyone wants to be to volunteer for that contribution in this way. I'm sure there are other ways that we can contribute via taxes or otherwise. So that's good to hear. Well, Suzanne, this has been extremely insightful. We are a few months away, less than 6, to that time frame that you mentioned. I'm sure there are folks that may not be Broadspire clients that are intrigued or concerned, quite frankly, based on what you've shared. What's the best way for anyone to contact you for maybe some guidance, some consulting, maybe possibly become a client before it's too late?
Absolutely. They could email me directly at suzanne.jordan@choosebroadspire.com. Absolutely. I'd be
Excellent.
glad to give any insight on
And
that.
Suzanne is very active in the market, championing the cause. You'll hear her on other podcasts and in written form as well. So I encourage individuals to go and listen and read. As you can hear, if nothing else, selfishly to limit your financial exposure, but also for the greater good of making sure that Medicare and Medicaid as well are funded appropriately. So Suzanne, thank you so much for joining us.
Oh, you're so welcome, Mark. One other piece I wanted to mention was there is the National MSP Network.org. They are a nonprofit organization that is it's a huge wealth of information. They have people from all over the industry, clients, carriers, reporting agents, and we go out and we do educational conferences and we network and we say, okay, what are you doing about this problem? I would encourage people to look at that website and maybe consider a membership. We're a member now, and it's really been extremely beneficial. You get information hot off the press when they meet with Medicare and things of that nature. So I would encourage that one
Can you
if
say
you're
that
trying
name
to
one more
learn
time?
more.
The
National MSP Network, and it's a
Perfect.
.org.
Perfect. Excellent.
So.
Suzanne, thanks again. Thank you so much.
Oh, thank you, Mark. Thanks for having me today. I really appreciate it.
You've been listening to Beyond the Claim, a podcast for risk and claims leaders. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time, stay curious and keep innovating.